We get lots of lectures at work about how to avoid being attacked or sued by people outside our job. What about getting attacked inside our job? We don't talk about that much, except I'm going to right now. Here's a fun story. This is Mike. He makes money with his hands and good reputation. One day his thumb and forefinger push a ring on his pinky finger. It's too tight and it gets infected. Mike's like, oh no, and his friend Cindy says, you've got to cut off that pinky finger. And Mike's like, no way. And Cindy says, if you don't, the whole hand will get infected and you'll have to cut it off and that'll hurt way more and everyone will know and you won't make any more money. So Mike's like, okay, and chops off his pinky. That wasn't so bad, he says, and he keeps on making money with the rest of his hand and it's a happy ending. Except for the chopped off pinky, of course, who gets blamed and shunned by everyone. His reputation is shot. He can't get work. He's depressed and angry because that thumb and forefinger who shoved that ring on him never got blamed and are still off making money with Mike. His mom is ashamed. He starts drinking and using pills, and his wife leaves him, and he ends up on Skid Row and kills himself. The end. If you haven't guessed yet, Mike is the hospital. His fingers are the medical specialists that earn the hospital money. Cindy is the risk management department. And the pinky finger is you, the ER doctor. The moral is, you are expendable. Risk management doesn't hate you, but they're supposed to protect the hospital. And if it's best for the hospital, you will get blamed, even if it wasn't only your fault at all. Why is it this way? Hospitals value money and prestige. Lawyers can take these things away by winning a lawsuit or threatening a public embarrassing lawsuit unless the hospital pays them hush money, called a settlement, to not talk about it. The more embarrassing the evidence is, the more money the lawyer can demand. A lawsuit against one doctor is costly and embarrassing, but a suit against multiple doctors is super costly and embarrassing. Even if risk management can't prevent the loss of some money or prestige, they want to reduce how much is lost. The patient and their lawyer have the right to see anything in the patient's chart, but it's much harder for them to review internal hospital documents like incident reports. So when a risk manager tells you documenting bad behavior of other doctors won't protect you from being sued, what they really mean is, we only want you to be sued because it costs less. And when they tell you you should only describe disputes with other doctors in a separate incident report, what they're really saying is, put the evidence where it's harder for the lawyers to find. None of this is bad advice, but it can go wrong for you. Let's tell another story. You're working in the ER and a patient shows up vomiting blood and he's real sick. And you're like, oh no! And you start treating him and then you call GI and say, he needs an endoscopy. And she says, put him in the ICU so they can transfuse blood and resuscitate him and I'll scope him in the morning. So you call the ICU doc and he says, he's too unstable. I will not take him until GI has seen him. And you call back GI and she says, if he has a problem with how I do things, have him call me. So you call back the ICU and he says, no, she should call me. And the ER is filling up with lots and lots of other patients, and the guy looks worse and worse, and you're doing more and more, but you can't keep up. You call your administrator for help, and he says, call them back and explain it to them. But they won't listen, and they won't help, and everything's going crazy, and 2 hours later, the patient dies, and his wife is devastated. You're angry, but the whole time you remembered what risk management said, so you didn't put any information about the dispute in the chart. Instead, you write an incident report describing what happened, just like you were told to. Soon there's a big lawsuit and you all meet with the hospital legal department. They ask if your incident report is true and you say, yes, that's what happened. And the GI doctor says, no, it isn't. He must be confused. Is there any proof? He did write that report after the patient died. And the ICU doc says, I agree with her. He's lying to hide his mistakes. And the administrator says, I can't remember. And the hospital attorney says, well, it's the word of 2 against 1, since there's no other evidence that what you said happened, and it's cheaper if only one doctor is at fault. We'll only put your name on the settlement we offer the family. Maybe we'll avoid court. Should you try to avoid this? If you believe that anything legal that's good for the hospital is by definition fair to you, don't do anything. On the other hand, if you have more classical beliefs about justice, then if you think unethical behavior is about to cause a catastrophe, you might want to leave a few karma clues in the chart, but only if it doesn't interfere with your ability to take care of that patient first. No matter how angry you really are, do not type out a rant. That just makes you look fragile and crazy. Instead, keep it cold, curt, and cryptic. All you want to do is give a minimalist account of this disaster as it's actually happening without showing a lot of emotion. This way, your attempts to get help are time-stamped and documented. Whether or not you also write an incident report, now no one can accuse you of making things up after the fact. Don't kid yourself. You'll still get hit by the bus, but so will everyone else who bears real responsibility. The hospital might lose more money, but you may be able to keep more of your own dignity, and that can be worth a lot. Is this a better form of justice? Is this plain old self-interest? Is it vindictiveness? Or is it something else? It's your life. You decide.